The time you spend with your doctor is really valuable, even precious. So how can you make the most of each visit?
And today on Health Talk, a senior internist with the Western Connecticut Medical Group will share with you what he tells his own patients in order to make every visit the best and most productive it can be.
So stay tuned for a great show. We're up next.
Hello, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. We want to make sure that you get the most out of each of your doctor's visits.
So joining us is Dr. Robert Altbaum. Bob is a senior internist with the Western Connecticut Medical Group. He's a good friend. He's been practicing as an internist in our community for over 35 years, and he's been a good friend of mine for over 40.
Welcome back to the show,
Glad to be here. Thank you for
Great to have you. So now we're going to hopefully get to how a patient can make their visit more valuable.
Sure.
We often think of the doctor's responsibility for that, but patients really have a big responsibility.
Patients could take an active role, and they can make their visit much more efficient, time valuable, and they get much more information and learn a lot more from the doctor, and the doctor can learn a lot more from them. There's not a lot codified on this. It's not controlled studies, but there's a lot of things written, and there's a lot of common sense.
Common sense, yeah.
And after 30 years of being in practice, I've kind of gleaned a few ideas that I'd be happy to share with you.
You've worked with many patients over the years.
Many
Maybe I could just start by asking about the 15-minute visit or the 20-minute visit, however. I mean, is that in stone? Why do doctors do that? And doesn't that sort of help dictate how to use that time most valuably?
Well, absolutely. I mean, doctors obviously see a certain number of patients. They have to obviously be efficient. They have a schedule they try to keep to. They want to keep to it. They don't always because of emergencies, but they really do want to do it. And when you have a limited amount of time, there are some kind of rules almost that you can do to really maximize the value of the time. One of the things, just speaking of time, first simple rule is be on time for the visit. If you're on time for the visit, you really will not feel rushed by the doctor. The doctor is trying to keep to his schedule. If you're late, he's going to feel a certain time pressure.
Let me ask you a question about that. When the time you have for your appointment, do you factor in the time at the desk then and expect to see them later, or should you come early?
Exactly. You should be on time, and the optimal thing now is to come about 5 or 10 minutes before the scheduled appointment, because there's always a new form, there's always an insurance, there's always a rule about privacy, there's something to sign and something to fill out. It takes about 5 or 10 minutes. So optimally, you come about 5 or 10 minutes before the visit, and then when you're called, the doctor will have that time allotted, and you're not rushed and he's not rushed. And that's the optimal way to do it. But being on time gets the ball rolling, and it gets you in a good place right from the beginning.
Sometimes with that early time, you can take care of things that don't need the face-to-face with the doctor, like
right.
providing a list of your medications, and maybe you can tell.
Well, yeah, the list of medications, I think every patient, that's actually very important. It's a critical factor. Patients think that doctors know what they're taking. They have 3 or 4 doctors, and somehow there's this ether that doctors are communicating, and that the doctor has sent a note, or it's all on the electronic medical records. Unfortunately, a lot of electronic medical records aren't shared. You really don't know what the doctor's changed. So if you bring your list, and you should list not only your medications, you should list any herbs you take, any supplements you take. All those drugs not only have side effects, so when you have a symptom...
And over-the-counter medicines.
And over-the-counter. It could be a medical side effect. And the other thing is they have drug interactions. So if the doctor is going to start a new medication and he doesn't know what you're taking, it actually could have a detrimental effect because of drug interactions. So always bring the list, bring it, and I like patients actually to write it down, the dose and the frequency that they're taking it, and sometimes even who prescribed it, because if it's not me, I like to know who's prescribing it.
Absolutely.
Yeah. And it's often, I think, helpful to know why you're taking it. Certainly, if you've prescribed it, you know, but there are medicines like antidepressants that may be used for depression, they can be used for pain, they can be used for a whole host of things. So it's really helpful. And I know that something I find very frustrating is I take a yellow pill for blood pressure.
That's right.
That doesn't help me.
And the worst is a white pill, because every generic is white, so it really makes it complicated. And when you're taking pills, it's really helpful to really be honest whether you're taking them the way. A lot of patients, they want to tell the doctor what they think the doctor wants to hear, and they don't want to disappoint the doctor, or they're embarrassed because they're missing a pill. Not to take away their concern, but studies have shown that 50% of patients do not take pills the way they were directed to take it. So it's a really common problem, and if there's one thing about taking medications or just lifestyle in general, be honest. Tell the whole truth, nothing but the truth. Doctors are not there to judge you. They're really there to help you. They're not going to blame you for anything, but they need to know if you're taking blood pressure medication and he thinks you're taking the drugs as he took it twice a day, and you're taking the drug once a day and you're missing 2 days a week, and you come in and your blood pressure is high, the natural instinct is to raise the blood pressure medication or add something new. That would be the totally wrong decision. It would simply be to make sure that you adhere better to the drug regimen. Same thing with smoking, same thing with diet. Whatever you're doing, be honest if they ask, or even if they don't ask, say, I missed this pill. It really helps them
I
treat
think
you
that's
better.
really important. And alcohol is something like that as well.
Alcohol, smoking, everything.
Which can
And
cause
sexual-
other...
And sexual activity, those things are
All very important.
And other drugs. So there are drugs of abuse that might be
Absolutely.
interacting actually with prescribed medications
And they have
in
their
ways
own
that
side
can
effects
be
and they
that can be
cause
dangerous.
symptoms.
So it's really important
So
to let
honesty
your
is a
doctor
really,
know.
and again, it's really important. Patients have to know doctors, what they say in the doctor's office stays in the doctor's
just gonna
office.
say-
It's private, and again, the doctor is not there to do anything but help the patient. You know, people think they're going to be judged. They're not going to be judged, but they do need the information so that they can really improve your care.
So even if you've told a patient to stop smoking or lose weight, and they've been smoking up a storm or eating up, they should tell you that they haven't.
Absolutely. I mean, one
And
is
you're not gonna be-
I will probably figure it out. I mean, if I ask them to lose weight and they haven't lost weight, something's amiss. And if they have, you know, if they have the smell of tobacco on them, but even if they don't, it's just if they're having an asthma problem, if they have a heart problem, one is there are lots of things I can do to help them stop smoking. So, but if I don't know they're smoking, I can't help them. And if
How
they're
about the
drinking, I don't-
patient's goals when they come and do a visit?
I'm sorry?
The patient's goals. What should they think about for themselves? In other words,
they
you
come
know,
to see the
we've talked about things that will help the doctor manage their care, but they may have a whole list of symptoms. They may have some primary concerns. You know,
Well-
how do you get all that in a 10, 15-minute office visit?
It's tough, and actually I would recommend against trying to get it all in. As much as I said I like lists when it comes to medications, I think patients, and again, if you read a lot of articles, AARP has articles, how to get the most of your visit, and they'll say write out on all your problems. That's fine, but you have to prioritize those problems. A doctor, let's say you said 20-minute office visit. Let's say there were 20 minutes for a visit, and a patient with a doctor, a new problem, takes at least 10 minutes to give it some kind of adequate in-depth evaluation. So in a 20-minute office visit, that's realistically 10 minutes per problem. If you come in with a list of 10 problems you've been saving over 6 months, which a lot of patients do, it's not like those 10 problems each get 10 minutes and magically you've expanded the visit to 100 minutes. What unfortunately happens is, in order to keep the time going properly, 20 minutes divided by 10 is 2 minutes per problem. You don't get you get a very superficial overview. You really hope yourself very little. So what you could really do is say, I think these are the 2 problems I need to address them, and then make another appointment. Doctors don't mind the other appointment. That's what they do. They want to help you. That's what they do for a living. They're glad to see you again. But that way, you get the problem addressed properly. The doctor can feel comfortable that he's done a good job by doing it. And basically, that's the best way to maximize your time with a big list. It may take more than one visit.
That's really important. And how about, you mentioned prioritize. How does a patient prioritize their problems?
Well, sometimes I'll have patients say, I'll say, let me see your list. I mean, that way, sometimes a problem that's important to them, and then they mention at the very bottom that they've had blood in their stool, or they've had chest pain, which to me is probably the most dangerous of the problems. So I'll often look at the list and say, we're going to deal with this, and we'll basically come back to the others as we can. The other alternative is obviously what's troubling them the most. If it's a follow-up visit, I'll deal with the problem that they're coming back to follow up first. And then I would ask them, what are the problems that are troubling you that you really want to deal with?
You're really describing a very collaborative
Absolutely.
process between
Absolutely.
the patient and the physician.
But then the patient, needs to help in that. Blood pressure and things that you are managing over the long term will have an important priority. But also, the patient's really concerned. Their uncle just came down with prostate cancer, and they're having trouble with urinating. They may want a prostate exam.
They can help themselves also by thinking about their problems. Very common problem that I see with patients, and it's not their fault, it's just they don't know what exactly to think about. They'll come in with abdominal pain. And I will say, where is your pain? And they'll say, oh, it's here, doc. And how long have you had it? Oh, a long time. And that's about the specifics that I get from the problem. They're concerned about it, they're worried about it, but they really haven't given any thought beyond the fact that it hurts. I understand that makes sense. But if they did kind of think about it a little before they came, what makes it better, what makes it worse, Does it matter whether they're eating? Is it affected by bowel movements, by certain foods? How much alcohol are they drinking? Does burping relieve it? Do they have any urinary problems? In a woman, if it's a low pain, is it related at all to her periods? All those can really guide me in terms of what the problem is. And it makes for a much more efficient visit. It helps me do a much better job at arriving at a differential diagnosis, or what that means basically is a list of possible problems that they have in differential diseases.
I think that's such a great point, because I think patients sometimes don't realize that all the questions we're asking, in a doctor's head, we're trying to figure out which path towards a diagnosis we're going to go down.
It can be very complicated, and we're going to obviously feed them. Sometimes I'll ask patients, I said, you know, these are the things I want you to think about. I'll actually give them a list of homework. I'll write down, you really don't really have a great handle on your pain, your abdominal pain. But when you go home, is it affected by food? Is it affected by exertion? Go home and tell me, and you call me in a few days and say, oh, now that I thought about it. And eventually they can actually learn to do that for lots of pains, because there's a repetitiveness to it. There's a definite repetition in terms of chest pain, abdominal pain, head pain. The same kind of questions get asked over and over.
And it's very helpful for us to figure out what's going on, those characteristics of the pain, all those things you're asking really help us diagnostically.
And so I ask them questions, and then they ask me questions. And if they ask a question, one thing that I, again, want to emphasize with questions, because it's important, patients will often ask a question, and they don't really quite understand the answer. That's my mistake. That's my problem, not their problem. But if you don't understand the question, or the answer to the question, you should really ask the doctor. Doctors have this tendency to go into medical speak. It's a language that we use. We use it as shorthand. We talk to other doctors. If a person has chest pain, and I say you've had a myocardial infarction, they may be staring at me and have no idea what I'm talking about. If I say you've had a heart attack, we're talking the same language. Same thing with belly pain. It's very, very helpful for doctors to be told, I didn't understand that. They want you to understand it. Communication is critical.
And
But
Bob,
it's our
you
error
say
sometimes.
things in the right way. A lot of times the tension in the visit is not conducive to people remembering what you said.
That's
So,
right.
so how does someone overcome that problem? Because I think there are studies that show people remember about a third of what you tell them.
Very, very common. I think doctors probably remember a third also. Basically, the really important thing in that case is to do two things. One is, I think, take notes. I always encourage my patients, or I give them notes, but you can take notes about what medication changes have been made, because there might be 2 or 3 changes. You should take notes about what your next appointment is.
How about people recording the visit?
Doctors you need to see.
Using their iPhones. Has anybody recorded visits with your advice?
Very infrequently. Some of the millennials do. Some of the millennials do.
But I think it's important, because I think some patients might feel, well, maybe the doctor will think I'm rude if I'm writing things down. But you encourage
Well, I
people.
actually encourage them. I say, or as I say, I start taking notes. And if they ask, can I take notes? Of course, they can take notes. But it's very, very, very helpful.
Very
for
helpful
them.
to remember things.
And the other thing is, sometimes I mean, obviously, if a person's elderly or has memory issues, that goes without saying. They should have another person. But there are some subjects that people, they're so emotionally charged. You're talking to somebody about their newly diagnosed cancer. They hear the word cancer, and everything else you're saying is white noise. They haven't heard another thing you've said, because you've used the C word, and they basically aren't hearing or processing what you're saying. Having another adult in the room, having another pair of ears, extremely valuable in terms of really maximizing what I've been told.
And that's tremendous advice,
Great
I think.
advice.
And that's all good advice for patients to help themselves.
Really cool.
Unfortunately, our time is up, so I want to thank you for this really informative discussion. We look forward to having you back for more discussions
Absolutely.
like
Clearly,
this.
we could have gone on talking for quite a while. We really appreciate it. And viewers, thank you for watching. Please remember to send us your questions and comments at healthtalk@wchn.org.
We'll see you next time, so stay well.